There are two main skills you will learn in this lesson. You will learn how to measure the volume of amniotic fluid and provide appropriate care if the amniotic fluid levels are too low or too high. The key terms that you will learn in this lesson are oligohydramnios and polyhydramnios. Oligohydramnios means that there is a decreased volume of amniotic fluid. Polyhydramnios means that there is an increased volume of amniotic fluid. Please pause the video to practice saying oligohydramnios and polyhydramnios with your trainer. The fluid that surrounds the fetus is called amniotic fluid. Amniotic fluid is mostly water and is contained in the amniotic sac. It helps the fetus in many ways. The amniotic fluid cushions the fetus, allows room for the fetus to grow, helps prevent infection, helps keep the temperature constant, and helps the fetal lungs develop normally. What will amniotic fluid look like on ultrasound, and why? Please pause the video now to encourage responses from the group. Because it is fluid, it will appear black on ultrasound because it is anechoic. Amniotic fluid is produced in different ways. Early in pregnancy, amniotic fluid is produced by the placenta and surrounding membranes. Later in pregnancy, most of it comes from the fetal kidneys and lungs. Because the amniotic fluid performs so many functions, it is very important to have the proper amount. Sometimes it can be either too high or too low, which can cause problems in the pregnancy. There are two ways to measure amniotic fluid with ultrasound, which we will now discuss, called the maximum vertical pocket and the amniotic fluid index. We use the maximum vertical pocket method, or MVP, with singleton pregnancies less than 24 weeks gestational age, or when twins are present. To find the MVP, locate the largest pocket and measure its vertical height. If there are twins, we measure the largest pocket for each twin. Measure the deepest fluid pocket free of umbilical cord and fetal parts. Note that cord or fetal parts may be seen in the image, but should not be in the vertical path of the calipers. A normal MVP measurement is between 3 and 8 centimeters. Look through the entire amniotic sac to find the deepest pocket. Measure the depth. Notice that the calipers form a vertical line, meaning straight up and down, that does not cross the umbilical cord or fetal parts. In pregnancies older than 24 weeks gestational age, we calculate the amniotic fluid index, or AFI. With this method, we measure the depth of 4 pockets and add them together for an AFI score. These pockets are measured in the same way as the MVP, and the vertical line cannot cross the cord or fetal parts. The normal AFI range is between 5 and 24 centimeters. There are 4 basic steps to find the AFI score. First, divide the uterus into 4 quadrants. In each quadrant, find the area or pocket that does not contain umbilical cord or fetal parts. Next, measure the vertical height of the deepest pocket in each quadrant. Add measurements from all 4 quadrants to get the AFI score in centimeters. The first step in measuring the AFI is to visually divide the uterus into 4 quadrants in your mind. Next, identify the deepest pocket of fluid in each quadrant that does not contain cord or fetal parts. This should be a solid black area on ultrasound. Notice that if we connect the calipers with a line, the line is straight up and down or vertical. This is a cross-section of the abdomen. There is just a small pocket of fluid in this image. We have labeled this pocket with red calipers to make it more obvious. Step 3 is to measure the vertical height of each pocket. Please note the calipers in this image and the vertical direction, meaning straight up and down, of the measurements. Finally, add all 4 measurements together to determine the amniotic fluid index. Is this AFI normal? Please pause the video now to encourage responses. The answer is that a normal AFI falls between 5 to 24 centimeters. The AFI in this patient is normal. Here are several examples of incorrect caliper placements to measure the size of the amniotic fluid pockets. Please pause the video now to ask participants why these caliper placements are incorrect. There are several reasons why they are incorrect. In the upper left and lower right images, the calipers are not straight up and down from each other. In the lower left image, there is umbilical cord in the vertical path connecting the two calipers. Remember that neither umbilical cord nor fetal parts can be in the path of the calipers. In the upper right image, the top caliper was placed too low, which means that the measurement for this pocket is smaller than it should be. Let's study this image more closely to determine why this caliper might have been placed too low. We have now enlarged the image. Look just anterior to the top caliper, and you will see a hazy or fuzzy cloud that blurs the true edge of the uterus. Here we have outlined this cloud, which is an artifact and is not really there. This is called a near-field artifact and can be seen sometimes in the near fields of the image because the ultrasound echoes bounce and scatter in the body wall of the patient. This type of artifact occurs more often in heavier patients. Sometimes turning down the near-field gain will reduce this artifact. The top caliper may have been placed too low in this image because the sonographer confused this near-field artifact with the uterine wall because their echogenicity is similar. Here we show the correct location for the top caliper, which was placed by estimating the greatest height of the amniotic fluid pocket from the uterine wall that can be seen just to the right of the top caliper. Here are examples of correct caliper placements measuring the vertical heights of amniotic fluid pockets. Please take time to look at these images now by pausing the video. In the lower left image, notice that there is a loop of cord, but that the measurement is taken next to it, and the vertical line between the calipers does not cross the cord. When the AFI is too low,